because our future depends on it. We are here today prioritizing immunization financing for child survival, making a case for immunization. Today, this press conference is not the normal press conference. Today, we are making a case for immunization. That is why we are here. We acknowledge immunization remains one of the most cost-effective public health interventions. It prevents diseases, it reduces mortality, and it contributes to healthier communities and a stronger economy. Vaccination and vaccines are miracles to prevent disease. Let us not forget that. We acknowledge with deep appreciation our President Bola Ahmed Tinubu, in his unwavering commitment to child health and survival. He released 2022 and 2023 outstanding domestic vaccine financing and also released 25% of 2024 domestic financing for vaccine. We celebrate him for doing that. We, members of the National Assembly, we cannot thank you enough. We cannot thank you enough for your continued support in championing domestic vaccine financing and oversight for effective utilization of immunization funds. Right beside us, we have one of our members from the 8th Assembly. It shows you how passionate the National Assembly is. We want to thank the National Assembly. We want to thank our Honorable Minister, Professor Mohammed Ali Pate, the Coordinating Minister of Health and Social Welfare, for his visionary leadership in repositioning the Nigerian health agenda, prioritizing immunization, and for the man-made strategy of the NPACDA to strengthen primary healthcare services across the country. He is a round peg in a round hole. He understands. You don't need to tell him. We want to celebrate Mr. Wale Edun, the Honorable Minister of Finance, and Honorable Minister, also want to celebrate the Honorable Minister of Budget and Economic Planning, Senator Abubakar Atiku Bagudu, for their strategic fiscal decisions and open door approach to dialogue. We commend the continuous increase in budgetary allocation to immunization since 2023, despite the current shrinking physical space. These actions are significant steps in the right direction. Immunization financing has continually increased in terms of budget. They know the value. They know the value, so we want to really celebrate all of them. Vaccines have saved lives and remain central to achieving Nigerians' health and development goals. Nigeria has made consistent effort to reduce child mortality through vaccination programs carried out in all primary healthcare centers in the country. Over the last few years, immunization efforts have, 1, expanded the routine vaccination coverage, 2, introduced new life-saving vaccines, including HPV, rotavirus vaccine, PCV vaccine, and many other vaccines. Latest one, we have the malaria vaccine, and all these vaccines are very critical to child survival. Nigeria is also about to introduce the measles rubella vaccine, all to improve the health indices of Nigerian children. Nigeria has also eradicated the white polio virus. Please clap for Nigeria. It was once a major threat that has mobility and morbidity, mortality and morbidity. These are remarkable achievements. We cannot but mention them. But the journey is far from over. Nigeria still has one of the highest numbers of zero-dose children. Zero-dose children are children who have not taken 1 dose of vaccine, a single dose. As stated in the DHIS software, DHIS2, Nigeria alone accounts for approximately 30% of zero-dose children worldwide, causing high child mortality rate. Behind each of these numbers is a child at risk of death, disability. These gaps in coverage threaten to reverse the progress we have made so far. Behind every statistic, it is not just a statistic. It is not a number. It is a name. It is a face. It is a family. It is a future hanging in the balance. It is not just data. It is a national emergency hidden in plain sight. We need to do more. Immunization is the greatest success story in public health. It is affordable, it is accessible, it is proven, it saves lives, it safeguards communities, it strengthens economies. Yet, in 2025, the basic right of every child to be protected from vaccine-preventable disease is still negotiated in physical terms. You cannot compare health with any other department. Health is wealth. Grace, James. Key messages to the public. Key messages to the public. Immunization? Okay. Remain top national health priority, even in the face of competing budgetary demands. Globally, WHO, UNICEF estimate that 3.5 to 5 million deaths are prevented each year because of immunization. Primary among them are children under 5. We cannot touch our foundation. Our children are our foundation. We must bring up strong foundations. And by doing so is to have healthy children. And vaccines support the health of our children. And then, yet, 1.5 million children still die annually from diseases that could have been prevented by vaccine. That is why vaccination is not an option. It is essential to child survival. We are building a case for immunization. Delayed funding for immunization programs puts millions of Nigerian children at risk. Risk of diphtheria, risk of meningitis, risk of stockout for vaccine and other preventable crises. Without consistent vaccine financing, over 1 million Nigerian children under 5 remain at risk of dying from diseases that could have been prevented by vaccines. Additionally, immunization saves an estimated 6,000 naira to 11,000 naira in treatment cost per child. Prevention is cheaper than cure. You pay less for prevention and you pay more for treatment. These monies that the poor families do not have. For every 1 naira invested in vaccines, 16 naira is returned in health and economic benefits. This is not just a smart investment. It is a life-saving investment. It is a smart investment. It is also life-saving. So with vaccines, it's dual. We save money and we save lives. This is not just a smart investment. I want to repeat it. It is a life-saving investment. Yet, funding gaps and delays mean that vaccines sometimes arrive after outbreaks begin. Strengthening domestic financing for immunization is essential. What it means, let me put it like a worry girl. Money to purchase vaccines must be available. Now money not make iron float. Now money make iron float. Our over 7 million children need vaccines. We owe it to them. So, strengthening domestic financing for immunization is essential to reducing dependence on donor funding and achieving sustainable, equitable health outcomes. What is our call to action? This is the most important part of this document. We want to beg, appeal, Yobazia, beg, any language, tell me. We want to beg the Federal Ministry of Finance. We understand very clearly the constraints of the physical space. We understand that the Minister of Finance has to cater for not only health, but other agencies and other things that are necessary. We understand it clearly. But we are saying that if the Federal Minister of Finance has to make a choice, he should please choose immunization. He should please choose immunization by releasing the outstanding 108 billion for 2024 and ensuring the full release of 231 billion for 2025. We want to state it again clearly that we understand the physical space constraints. We understand that the Minister of Finance has to make a choice with the little money that Nigeria has and know how to prioritize different things. We understand it. But we are saying today, if you want to choose, please choose immunization by releasing the money to purchase vaccines. We are appealing. 2, in Nigeria, timely immunization is not just a calendar event, it is a lifeline. Every day, vaccines are delayed due to slow, fragmented, or incomplete funding. A child somewhere is left vulnerable. Their tiny bodies, wide open to diseases they should have been protected from their first birthday. So we are appealing. We are appealing. The first level is the vaccines have to be bought. And we cannot buy the vaccines with air. Praise the Lord at this time. To the state governments, we urge the state leaders, our state government, we urge you, we beg you to adopt and adapt frameworks that ensure routine and emergency vaccine funding that they are embedded in the state budgets and released timely and utilized efficiently and effectively. To our policymakers, we still want to reiterate the fact that we are grateful for the role that they are playing. We want to appeal to them to make sure that our policy environment supports the allocation and timely release of immunization funds, because every naira released late will mean the difference between a child's first birthday or their final breath. It is very important that we know this. To the private sector and the civil society, our constituency, we must support sustainable immunization financing, and it requires multi-sectorial collaboration. We call on private sectors, private actors, NGOs, civil society to play active role in advocacy, awareness, co-financing effort to strengthen immunization across Nigeria. Vaccines save lives and saves money. Appreciation and conclusion. We commend our President Bola Ahmed Tinubu, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pati, and the Honorable Minister of Finance, Mr. Wale Adu, for their leadership and ongoing commitment to strengthen Nigeria's immunization agenda. Immunization saves lives. Financing it sustainably ensures those lives are protected, not just today, but for generations to come. Let us recommit ourselves to building a health system that actually, truthfully, leaves no child behind. And to ensure that immunization remains strong priority in our national health agenda. Thank you for your attention. It's one of the things that CSOs are doing. We are calling the attention of everyone to realize that vaccines are important and the releases have not been done as they should have been done. Secondly, we are also calling the attention of all the duty bearers to also be aware. We also are saying that we realize that the physical space is shrinking. The government has to prioritize. The government has to the Minister of Finance has to prioritize. And what we are saying now, please prioritize vaccines. Because if there's an outbreak, if there's an epidemic, every other thing we're talking about will stop. Let us not forget the case of COVID-19. COVID-19 should ever be in our mind. COVID-19, the whole world stopped. Every other thing stopped. And that is a health emergency. We don't want the country to get to that point of a health emergency. And many other CSOs are also on this. It's not only us. The Health Sector Reform Coalition is also on this as well. And many other organizations are also on it as well, creating awareness, informing, begging, appealing to make sure that the case for immunization is made. So I just want to say why I give the cost for immunization vaccines. Let me take that one. We put it there. The most minimal cost is what we put here. When a child is ill, you take the child to the primary health care center. The mother will spend minimum of 6,000. The reason we know it, what we are putting here is between 6 and 11,000, is not from any book. It's from our own personal experience at the community. When we have to pay for a mother or a father whose child has fever, and we take the child to the primary health care center, they want to give paracetamol, they want to give this. You will pay 5,000, at least. You will, even the transportation from his house to whatever the facility is. And if the primary health care center cannot cope, that child will be referred to another hospital. Transportation cost is at 11,000. I'm very happy that we have a lot of mothers here, and you understand what I'm saying. It's at that 11,000. By the time they do tests, if they say it's malaria, they will do malaria tests. And by the time they do the test for malaria, and they say, oh, it's typhoid or it's malaria, test can continue again. By the time you start to think of buying the drug, the mother has left her job in the market. She's there. She's supposed to be selling in the market, but she's in the hospital. So the amount of money that is lost, it is not only the immediate costs, even the cost of the woman is supposed to be in her shop, she's not there. The child is supposed to be in school, he's not there. The mother is in the hospital instead, also begging for money. Her mental health. They now say, okay, there's a test that the child has to do, and that test is 20,000. The mother does not have 20,000. The mother starts to reach out to, for those that have people, start to reach out to people. For those that don't have, they take that child and go back home. What do you think happens to that child? So when we want to talk about the cost, it's way more than you are thinking. Cost on the family, cost on the child, cost on the community, cost in the country. Those costs are unbelievable. So it's very important that even when I say between 6 and 11,000, it is just the first level cost. So I would now defer to Honorable Usman to answer some of the questions. Thank you.
I want to dwell on the issue of prioritization. If immunization is prioritized, certainly we will not be here. Imagine, from the report, we have seen that in 2024, we still have an outstanding of 108 billion naira. That's the call to action. If immunization were prioritized, that wouldn't happen. That payment would have been made. But even if the government pays today, it is paid in arrears. Nobody knows how many children had died, would have died, within this period. It's lack of prioritization that is causing that. Now we are in a new year. We are in August now, the 8th month, and we have technically how many more months to go? 4 months. And we have 271 billion that is yet to be paid. So we have 108, we have 271 billion. If you add together how much you have. Honestly, lack of prioritization is a major thing. And except we continue, to call on policymakers to prioritize, these things will continue to happen. Like she said, like we all witness, may God forbid Nigeria or the world having another period of COVID. When it happens, unfortunately, everything stops. So why do you allow, why do you take chances with people's life, with economy? The government, I believe, shouldn't take that chance. It's risks, that high risks. So privatization is key, and we must dwell on it. Yeah, like we said, we are happy with the appreciation. When the government came on board, it has increased the provision. But it's not enough to increase budgetary provision if you don't make prompt release. And you only make prompt release if you prioritize. So we need to call on the government. The National Assembly is doing its best. Very soon, they would start process of the 2027, is it 2026 now, budget, And honestly, by the time they've even started, they would be interacting with the agencies. They will be asking questions. And certainly, members of the National Assembly, I bet you will not be happy with the situation that we are in. Because they will not want a situation where in 2024 they had appropriated a certain amount of money, and that money, 108, is still hanging. And then in 2025, 231, is really hanging, and then yet they are expected to, this sort of thing discourages parliamentarians from appropriating more money. And that is why, in as much as we are saying that even this money is not enough, whatever, this total, if you release it today, is still not enough. But the government should please release it. That will encourage the National Assembly to say, look, we will give more money in the next budget cycle. Thank you.
Had a workshop at the Hilton, and that workshop brought together various stakeholders to look at the immunization financing space in Nigeria, to look at the gaps, to look at the issues. They brought members of the National Assembly. Senator Banigo, for instance, is doing a lot. She has a bill currently at the at the Senate level to make a case for a bill to make immunization financing a first-line charge in the national budget. And I think that is a very commendable move, and I think all the partners and all the CSOs are working to support her in terms of moving that forward. At the House of Representatives level, we have been engaging with quite a number of the House of Representatives members, particularly Dr. Amos Magiji, the chair of the House Committee on Healthcare Services, who is one of those championing the cause of making immunization top-line priority by the federal government. We also have in the executive branch a minister who we must commend for his interest, in particular affairs of women and children. Recall that Professor Mohammed Ali Pate was actually hired to be the Director General or Director of Gavi, and because of the love of his country, he decided to come and serve as Minister of Health. And of course, you know that Gavi has been supporting several countries in addition to Nigeria. So that tells you that the minister himself, has been really up and doing in terms of making the case, writing letters, reminding the Minister of Finance on the need for the release of these funds. We commend him, and we are also saying he still needs to do more. We also have the Dr. Muyaina, the Executive Director of the National Primary Healthcare Development Agency, that we're also engaging. We're engaging with all the stakeholders across the board, and we are hoping that in spite of the challenges that we recognize, in spite of the fact that we, in fact, you recall that the government recently is also still taking loans. We know that we're running two budgets at the same time, 2024, 2025. We know that even the 2025 funding for it has been a challenge. But as the focus, as the theme is today, if you have to make a choice, choose immunization. Because the return on investment, a $1 investment in immunization gives a $44 rate of return. You can check that out. That means that the economic cost of not immunization, if you invert it, is huge. It's enormous. And we know that human capital is the most important of all the resources on earth. And therefore, I would like to lend my voice, to add my voice to all the other voices to say that yes, in spite of the challenges that we have, government should please, please, please prioritize immunization and ensure a better future for our children. Thank you very much.
Since this, remember in the 90s, immunization started in this country, EPI and others, and we've gone through a lot, and we are still here discussing financing, discussing sustainable financing for vaccination and other health issues in this country. And to me, we are looking at prioritization as a must-do. In fact, I'm not even saying you have any choice. It's just like saying you must eat. When you are hungry, this will be food for you to eat. It's prevention, it's promotion of health. So when you put vaccine, I should have a choice. That means I'm not serious. So we want something, government is fueling vehicle every day to move from one point to the other. Vaccination funding should be like that. We want that you wake up, as you fuel your vehicle, you are releasing money for vaccination. Because what it does is far more and over what you can ever imagine. So it's been a very serious and painful matter. And the innovative approaches that I've seen now for over years, over 25 years I've been on this innovation thing. But I've seen something this year that I've never seen before, with the approach towards introduction of the measles rubella vaccination in this country. I've seen the innovation that has been adopted. Advocacy is a very veritable tool that we must understand. You must understand advocacy. Advocacy without ask, without follow-up, without you having a dashboard to track commitments can never work. And this is exactly what is happening now. Do you know that we have gone to the director of budget for this country, and we have confirmed that they have created a budget line with funding for measles rubella vaccination for this country, and it's there. So we have asked him to give us a timeline when it will be released, it will be funded. We want that money to leave the federation account and come into where it should go to for action. And we have also activated 36 states at FCT. In fact, yesterday, the Secretary to Health and Environment Secretariat, Mandate Secretary, made a commitment, verbal commitment, but you know that we are articulating a letter now. She's going to endorse it. So she's going to tell us, because we reminded her that the budget for 2024-25 have already been approved, and they are about to, some of them are being implemented now. So you cannot introduce MRV that is going to be done in October now. So is it for 2026, or are you going to do environment? Are you going to do, so these are the questions we wanted to answer. We want to track it until it is released to FCT. We have done that for all the 36 states. So Commissioner for Health, Commissioner for Budget for every state, we have obtained that commitment for the MRV. So the civil society is doing so much. And we don't want a situation that we are going to talk of you being reminded of funding vaccination. So what are we doing next? We found out that many states, including, apart from, in fact, aside FCT, establishment legislation, funding is a very critical issue. You may have a policy, it will not drive accountant general of the set. Policy that you should release funds for, it can never work. When that memo goes to the accountant general, he's going to ask you of the law. What is the law? If the law is not there, we will push your file aside, no matter what the governor does. I'm telling you the truth. This has happened in so many states. I've seen this in so many states. So we now want the state private healthcare boards that are responsible for vaccination in this country to intentionally review the National Health Act for basket funding. So all these partners, development partners, everybody that is doing this, so create primary healthcare fund that every partner will put in. So we have about 4 different sources of funding for primary healthcare and immunization in every state. That number 1, statutory allocation that's going from government, donors, agencies, WHO, UNICEF, align your budget and your plans. One plan, so that WHO is to support you in logistics and all those kind of stuff. So you now put that budget down, and we now align it with the cost. Total cost is X, WHO is bringing Y, UNICEF is bringing T, government is bringing A. So we now add all of them, we will make up that X. So we don't want something you don't make a budget and keep it there. So this is the advocacy that the civil society, that we are going to try to with community. And we found out that if you don't do this, and the Accountant General says that there's a law establishing that fund, you can never release it, no matter how you wish that immunization is funded every day, but as it comes. And this country has, every state has an approved vaccination framework, costing framework for every year. They develop it. What would cost to do vaccination for the whole year is there. But it's not released because they don't have law, they don't have legislation that is backing it to drive it to the point of crystallizing it to funds. Then finally, for me, there's a critical aspect that we are sitting down here. We are thinking that village committee's approach to primary health care is just for the villagers. Do you know that we can, Asoko is a community? By the time it's a community, you do primary health care according to the capacity of the community. You fashion it to blend with the lifestyle, economic status, and everything of anybody, wherever you are. Even the presidency, also Rock is a community, can do primary health care there. What do? You tailor it in a position that both the ASO Rock and government can afford to sustain at every point of their development. So the one I'm doing in Village A, that is just rudimentary, having just very underserved communities, different from the one I'm going to do. But they're all primary health care where people are involved, people with voices. So we want a situation that the committee system that is part of the national health system established in the National Health Act 2014 as amended, that the national health system starts from the Federal Ministry of Health and ends with the community, where all the traditional practitioners, the traditional bed attendants, private hospitals, all clinics, everything, they are inside there in that community level committees. So you form that committee, facilitate the information, and let the people do their work. This is where the people's voice will come. So you don't establish, facilitate that to form that committee. They cannot actively involved in health and immunization activities. They can ask questions and then fund and bring their resources. For me, the final thing I would say is that to indicator, a very critical indicator for primary health care financing or support is the proportion of community resources that have been plowed into primary health care. If you add that indicator, it is rising, primary health care is happening. But in this country, it is zero. There is no community resource that have been mobilized for primary health care. It's only funders, WHO, that they are going to government. Government will appropriate that and it disappears. So we want community resources to be mobilized through committee approach and then to align with the National Health Act, and then so we are advocating for that to be done. So I want to thank you very much.
Yes. The money. So it boils down to 2 things: what Honorable Usman had said, and also what Professor Emmanuel had said. So number 1 is prioritization. So CSOs are also working in helping the government prioritize properly through that first line charge. We are with the legislators pushing intently, pushing continuously for there to be that particular thing. So you know that you put your money where your mouth is. So we've been saying, okay, we love our children. The children, they are the future of Nigeria and everything. So why don't we show it by doing that? So that's one. And the second one is timely release. This timely release is important because even if we do it behind, what has happened is there had been some deaths, there had been some issues, there have been some other things that had happened that we cannot go back to recollect and now say, okay, we have saved it. Then on what Dr. Ewart had said, Vaccine Network for Disease Control, at the subnational level, we are not just looking at national level. At the subnational level, we are actually mobilizing domestic resources through the private sector. So we are working in Bauchi State, Adamawa State, Jigawa State, Gombe State, and Kano State. So these 5 states, we have actually begun domestic resource. We are working with a set domestic resource mobilization technical working group in all the states. So where we are engaging with the private sector, the private organizations to look at, okay, aside from what Nigeria is doing, government, the budget everybody is grappling is like the big pie that everybody is looking at. What are other resources that are within the state, that are within the community, that could actually help take this vaccine even to the last mile, also help the state, the local government to fund the vaccine that are coming into their state and let it get to the children. So we are working with the ESCs, with the DGs there, and it has been very, very wonderful and helpful. Sorry, my FCT was not included. But maybe with time, she's just calling FCT and looking at me. Okay, thank you very much. So that's just what I want to say. So efforts are sensitizing the duty bearers. CSOs, we don't really lobby. I don't know why nobody said something about that. Yes, we advocate.
We are advocates.
We are advocates. We help to advocate. Lobbying. Well, there are even some funds we worked with. It is written clearly. You cannot use our funding for lobbying. Okay, thank you. So you wanted to say something?
The world, at the world level, that forms the 4th level of world health system. What is the health-seeking behavior of the person whom we want to administer that vaccine at the community level? People don't tend to give it as a priority to take members of the community who are the end users of this product who are dishing out. So we at the World Development Committee level, we work together with the FCT Traditional Council, especially with regard to immunization, headed by the Emir of Jua. We have the Council of Imams, the CAN, the War Week, and then we at the WDC, we work as a team to ensure that members of the community are mobilized, as I said, to see the importance of having their children immunized, or mothers, especially the child-giving mothers, right? But the issue is that our major concern, and that is where our problem is, the issue of priority. Do the government, it is wanted to release, do they actually have oversight function to see that what is being released is being utilized for the purpose? 2, we just came back from 4-month primary school, primary health care strike. Now you find that these issues bring about mistrust on members of the community. You want the, who are pass information, go and get their child immunized. It goes to the facility, no person to immunize the child. Then now results go to traditional system. Now, even just barely, after the 4 months, I'm sorry to say, you find that a local government now, area council, Bogalada, they have resorted again to strike. All our PACs are now equally locked after the 4 months. So what are we prioritizing? Do the members, the subnational, the local government chairman, and all those in position of authority, do they see health as a priority? Do they see immunization as a priority? If not, do they actually have the interest of members of the community who they are serving? How can you lock a health facility? And by the time you go to the teaching hospital, where there's no proper referral system, the cost, as Madam has rightly said, how much is a drop of polio? How much is a shot of a vaccine of either BCG? Can they afford it? So this issue of mistrust and lack of giving priority to immunization and reaching out, making it available. Even if they are available, the place is locked.
So what do we do? So our duty as WDC, we are mobilizing. We are mobilizing people to change their behavior, to accept immunization, because we know prevention is better than cure. You spend less, just question, you can even trek to a facility, but if the child comes out with an infection, which can be prevented by vaccination, it's a disaster. So we're teaming up. We want to appreciate the vaccine network for the good job you have been doing. We have to appreciate the National Assembly members. But we are saying that all functions, all people, at whatever level, the oversight functions, National Assembly, the ministries, the General Office, they should look around. It is being done. Are we getting it? Yes, we have evidence to show that the rate of children coming out with polio is grossly reduced, okay? But there are emerging situations. Are we ready to battle and take care of those ones? Like the measles, rubella joint vaccine is coming up in October this year. How prepared are we? How prepared? If the vaccines are there and the vaccines are locked and the staff are not there, who administers it? How do you achieve it? So let me leave at this level. Thank you.
6 states and FCT and all the local governments of the Federation. And, you know, our main aim is the well-being of Nigerian women and children are our priorities. And we can go at any length once it concerns, you know, their well-being. And so when we are talking about, you know, immunization, you know, because as you come out of life, immunization, you know, is the first savior of every child in Nigeria, because infection does not know whether you are a baby or whether you are immunity or whatever it does. So we advocate strongly, you know, for immunization, you know, to take topmost priority, you know, in the health of Nigerian children, women and children. And so, you know, we as a women group, because we know that the woman, at the end of the day, if any child fall victim of, you know, not being immunized and they fall, you know, the victims of these illnesses, at the end of the day, it's the woman that suffers it. You know, because, and we all know that in Nigeria, women form the largest force of economic building in Nigeria, because women are everywhere. We are in the marketplace and all what we do, because those who are in the city, you know, they have the media to listen. Well, you know, through the NCWS, we make sure that the advocacy, the awareness, the education goes to the grassroots to educate women, you know, to take their children for immunization. And we do that, you know, through different languages, you know, so that everyone is well informed. And so, you know, when, like Margaret has said here, that at the end of the day, when all these facilities are, you know, under pressure, you know, not being funded, you imagine a woman will leave her market just to take a child to for immunization, and is able to get, and then come again another time, and then, you know, leave businesses and all of that. So we are, you know, through my president, Princess Edna Azura, the president of the NCWS, you know, we take some of these issues, you know, very seriously, and we collaborate with the Ministry of Women Affairs. You know, that's where, you know, some of our issues are being directed, and most of the things, you know, that we have been advocating, they are taking attention. And so with the immunization also, we will advocate, you know, for its implementation and the release of the fund through the wife of the president, Oluremi Tinubu, who is, you know, the champion. You know, she does not joke about women and children. And so through that, we will let, you know, our voice also be heard, so that she can also push on, you know, for the release of this fund. Because you know, the health of the Nigerian woman and child is the wealth and health of the nation. And so we advocate strongly for the release of funds to take care, like, he rightly said, especially, training. We as women, we believe, we have so much trust in the person that is attending to our children. And also, so that those people who are giving this immunization, they are also, well-trained, they're also well-trained so that, they gain the confidence of the people, of the women at the grassroots to give their children immunization. So we also, we are putting our voice to advocate also for the release of, funds to cater for immunization and also make immunization a priority in our nation. Thank you.
Thank you. For what?